Hi all, this is BALAJI NUJELLA, your physiotherapist from Galen Multispeciality Clinics, Mayapur. Now, the previous episode we have discussed more about whether one has to go for surgery or not. Now, the second question comes. Whenever there is surgery, surgery is basically a scary thing. For sure, for regular people, it's a nightmare. The very word surgery is a nightmare. So, there can be another doubt or another question from your heart. Like, thing is, are there anything other than surgical intervention which can be tried for your knee pains or osteoarthritis? Yes, for sure, yes. There are many other methodologies or many other treatment procedures which are being followed since times long, somewhere around 1980s and 1990s. These techniques have been followed at many places. Recently, they are being implemented or they have been well practiced in India also. The main things other than surgeries, the main methods are, one, everyone might have been quite well versed with this, that is hyaluronic acid injections. Most commonly they say the injections which improves the gel inside the knee joint. It is not the gel inside the knee joint, but your knee joint, because it's a synovial joint, it has got synovial fluid. In your normal course of time during your knee osteoarthritis, there can be bad decrement in the space as well as decrement in the synovial fluid also. So what is the first option is injecting with hyaluronate. There's something called as hyaluronic acid. Injectable hyaluronic acid, it is more gel-like, or it's more a bit viscous type of tissue, material or the medicine that is injected into your joint space in the form of, or which acts or which supports the synovial fluid and which improves the lubrication inside the joint. So that is first technique. The second technique is platelet-rich plasma. Platelet-rich plasma is another important milestone in the treatment of knee joint treatment or knee joint pain treatment and all for osteoarthritis. These are actually the medical treatments which are followed by the doctors. The platelet-rich plasma is nothing but your blood is simply drawn out, or a sample or the blood thing is drawn out. It's been centrifuged. The plasma with platelets is being taken from the same blood and re-injected into the joint to produce new tissue regrowth or repair at the, regarding the injured cartilage, I would like to explain you one important thing. How does your injured cartilage look like? It looks as if, or it feels as if it's more like a ceramic material. It is so soft and ceramic-like material. What happens is, when there is severe degenerative disease, your cartilage gets worn out. So by injecting the platelet-rich plasma, this plasma with platelet-rich components will go there and it is injected into those sites where the cartilage is worn out, and that will promote healing of the tissue there. So that is another method. Also, recently there's been a surgery other than transplantation, the knee joint OA knee or knee arthroplasty. Other than knee arthroplasty, what they have done is there is something called as OATS, osteochondral transplant system. What is that? It is nothing but your bone along with the chondrum, that is the chondrium, that is cartilage, the outer surface of the cartilage, along with the subchondral bone, a plug is being taken from the non-weight bearing part of the knee joint and it is transplanted into the weight bearing, or where the cartilage is worn out even when the bone is exposed. That part of the chip is transplanted here, and the whole thing is an arthroscopic surgery. But if the worn out area is larger surface, then the graft can be taken from your knee joint, the non-weight bearing part of the femur of the knee joint or the thigh bone of the knee joint, and the grafts can be harvested, or it can be kept aside, harvested, and again reimplanted with an open surgical procedure. The grafts can be of two types. If the graft is taken from your own weight bearing structure it is called as autograft. Or if the donor is some other person, then it could be an allograft. So basically this oats surgery is also there. All these things are platelet-rich plasma, your hyaluronic acid injection, all these things are known procedures which are in vogue. There are many other procedures which your orthopedician knows, because science is always advancing, and there are many simple and less risk what people feel as, because surgery is risky thing what people feel. So comparatively easy procedures which are being cropped up as a part of research regarding the osteoarthritis knee. And last but not the least, whatever surgery, whatever type of procedure you get done for your knee joint pain or your osteoarthritis knee, the important thing or the important procedure what you should take care is taking care of your knee joint. That I'll discuss in the next session. So before going to replacement surgery, kindly discuss with your orthopedician. In fact, do not Google it out, or do not take this program as a testimonial, and or it's not any proof that to discuss or to argue with your orthopedician. Your orthopedician would be the best person to decide what procedure you have to undergo. But sure, you have all the rights to discuss the possible treatment procedures and then go for the best opt which your orthopedician suggests. But last but not the least, whether it is surgery or non-surgery, it is your care which is going to help you out, or self-care which is going to help you out, whether it is pre-surgical care, post-surgical care, and all these things I'm going to discuss in the next meet. So till then, just take care of your knee joints, walk healthy, stay healthy. Thank you.